This is Julima Wellness Consultancy in Murera, Theta, Juja, Kiambu, Kenya, East Africa, Africa. Let's hear about anxiety disorder. Anxiety is an emotional implicated to heavily in psychology. Freud considered it as having a great impact on a person's mental well-being. Fear is closely related to anxiety, but is somewhat different. Related to fear is panic attack, which is fear unfounded. Anxiety is a negative mood characterized by bodily symptoms of physical tensions and apprehension about the future. It is a subjective sense of unease, a set of behaviors looking worried and anxious or fidgeting, or a physiological response originating from the brain and reflected in elevated heartbeat and muscle tension. In moderate amounts, anxiety is good since it enhances socio-physical and intellectual performance. Mostly like the time you are doing an exam, you are very anxious of what you will get. So you will take your books, read, repeat what the teachers have taught, and by the end of the day, when you will go to the exam room, you will have something to do. According to Sigmund Freud, there are three kinds of anxiety. Reality anxiety, which is the fear of danger from the external world and the level of danger in proportionate to the degree of threat. Neurotic anxiety, excessive fear that the danger is too much and it will overwhelm the ego. Moral anxiety is the fear of one's concerns. People with well-developed concerns feel guilty when they do something contrary to their moral code. Anxiety disorders also occur with several physical conditions such as thyroid disease, respiratory disease, gastrointestinal, arthritis, migraine, and allergic reaction. The focus is generalized to the events of everyday life. GERD is characterized by excessive worrying, apprehensive expectation, occurring more than 6 months. Furthermore, it must be difficult to turn off or control the worry process. Physical symptoms associated with GERD include muscle tension, mental agitation, fatigue, irritability, and difficulty sleeping. Focusing attention is difficult as the mind quickly switches from crisis to crisis. People with GERD worry about minor everyday life events, possible misfortune, etc. Treatment: drugs such as benzodiazepines and antidepressants. Psychological treatments are affected since people with GERD seem to avoid feeling of anxiety and the negative effect associated with threatening images. Clinicians have designed treatment to help the patient with the GERD process the returning information on an emotional level, using images so that they will feel rather than avoid feeling anxious. Such treatments include behavioral therapy, relaxation techniques, cognitive behavioral therapy, confronting anxiety-provoking images and thought, ahead or meditation approaches, etc. Panic is a sudden overwhelming panic disorder. Panic is a sudden overwhelming reaction of fear, named after the Greek god Pan, who terrified travelers with blood-curdling screams. In psychopathology, a panic attack is defined as an abrupt experience of intense fear or acute discomfort, accompanied by physical symptoms that include heart palpitations, chest pain, shortness of breath, dizziness, nausea, derealization, fear of losing control, fear of dying, tingling sensations, and chills or hot flashes. There are three types of panic attack. Situationally bound. If you know you are afraid of high places, you might get panic attack when you are there, but not anywhere else, especially in bridges, in flyovers, those places. Unexpected and crude panic attack. No clue when or where next attack will occur. Situationally predisposed panic attack is between these two. You were more likely to, but will not inevitably, have an attack where you had one before. There are two types of panic disorders. Panic disorders with agoraphobia, PDA. Panic disorder with agoraphobia, PD. In PDA, the individuals experience severe unexpected panic attacks because they don't know when an attack may occur. They develop agoraphobia, which is fear and avoidance of situations in which they feel unsafe in the event of a panic attack or symptoms. Situations hard or embarrassing escape to get home or hospital. In severe cases, people with PDA are unable to leave the house. In PD, the individuals experience anxiety and panic without developing agoraphobia. To meet the criteria of either panic disorder, a person must experience unexpected panic attack and develop substantial anxiety over the possibility of having another attack or about the implications of the attack. Thinking that his attack is a sign of death. Treatment include medications such as Prozac and Plaxio, which are serotonin reuptake inhibitors. Psychological interventions such as exposure therapy, cognitive therapies confronting basic attitude and perceptions about the feared situation, which are often unconscious. A specific phobia is an irrational fear of a specific object of a situation that markedly interferes with a person's ability to function. Exposure to the feared object or situation can cause a panic attack. Person recognizes that the fear is unreasonable. Phobia situations is avoided or endured with intense anxiety or distress. The duration is at least 6 months. There are four major subtypes of specific phobia. Blood injury injection type. Situation types such as aeroplanes, elevators, or enclosed places. Natural environment types, e.g. heights, storms, water, animal type. Other include situations that may lead to choking, contracting illness, loud sound, costumed characters, etc. The main difference between situational phobia and PDA is that people with situational phobia never experience panic attack outside the context of their phobic objects or situations. Therefore, they can relax when they don't have to confront their phobic situations. In contrast, people with panic disorder might experience unexpected acute panic attack at any time. Treatment: exposure therapy. If somebody fears to go through the flyover, let her or him go many times. If in one day he goes thrice or 4 times or 10 times, then by the end of the day he will get experience, and the phobia will go. Social exposure therapy, sociophobia, also called social anxiety disorder, and an irrational fear of social situation. It is more than exaggerated sadness. There are as many phobias as there are objects and situations. Phobias, starting with the letter taken from the medical dictionary, are 25 in number, including acrophobia, fear of insects; acrophobia, fear of darkness or night; ailurophobia, fear of cats; outrophobia, being alone, fear of being alone, etc. Treatment is like for other phobic disorders. For sociophobia, role play is effective in addition to CBT. Drugs such as tricyclic antidepressants are quite effective. Post-traumatic stress disorder occur after a variety of traumatic events, e.g., a rape, car accident, earthquake, etc. Post-traumatic stress disorder, the setting event for PSSD is exposure to event during which one feels fear, helplessness, or horror. Afterwards, victim re-experience the event through memories and nightmares. Victims avoid anything that reminds them of the trauma, display a characteristic restriction or numbing of emotional responsiveness, which may be disruptive to interpersonal relationships, are sometimes unable to remember certain aspects of the event. They are chronically overclouded, easily started, and quick to anger. Difficulty sleeping and recurring intrusive dreams of the event or prominent visa or PTSD. Other symptoms include hypervigilance and regressive behavior. PSD can be divided into acute PTSD, which can be diagnosed a month after that event, and chronic PTSD, which is PTSD when it continues longer than 3 months and is usually associated with more prominent avoidance behaviors. In PSD with delayed onset, the individual saw how or no symptoms immediately after the trauma, but later after near, they saw full-blown PTSD. Treatment include imaginal exposure, in which the content of the trauma and the emotion associated are worked through systematically, developing a narrative about the event, which is then reviewed in therapy, another technique. Cognitive therapy to correct negative assumptions about the trauma, e.g., guilt, self-blame, can also be useful. Debriefing is also helpful to prevent PTSD. Drugs therapy such as Prozac are also effective. Obsessive compulsive disorder. In other anxiety disorder, the danger is usually an external object or a situation, or at least the memory of one, but in OCD, the dangerous event is a thought, image, or impulsive that the client avoids as completely as one with a snake phobia avoids snakes. This is quite difficult to concentrate on not thinking about pink elephant. Impossible because it is difficult to suppress a suggested thought or image. Individuals with OCD fight this battle all day, every day, and they usually fail miserably. Obsession are intrusive and mostly nonsensical thought, images, or urges that the individual tries to resist or eliminate, e.g., thought of disease. Compassion are the thoughts or action used to suppress the obsession and provide relief, e.g., thought of thieves coming into house, so sex. If doors is closed all night. Types of OCD. There are four major types of obsessive, and this is associated with a pattern of compulsive behavior. Symmetry, which refer to keeping things in perfect order or doing things in a specific way. Forbidden thoughts or aggressive, sexual, religious, e.g., feeling one is getting to yell a swear word in church. Cleaning, contamination, the individuals obsessed with fear of contaminants or germs, hence are compared to excessive washing, using gloves, masks on every daily course. Holding. Individuals with the OCD compulsively hold things, fearing that if they throw something away, even a 10 years old newspaper, they then might urgently need it. Patients with holding nerve, houses, heart, disables a junkyard. Treatment: drug therapy, e.g. clomipramine, psychological treatment, e.g. exposure and lesion preventions. Lesions are actively preventing, and the patient is systematically and gradually exposed to the feared situations or thoughts. Psychosurgery involves a surgical lesions to the cingulate bundle. Hey, that is where peoples you see, if they were told by the pastor not eat, they can't eat. They can't eat. They can stay without eating for a month, even if they die. They don't fear. If they were told by a pastor, go and sell that car and bring that money so that you can be blessed, that person will go and sell that vehicle and take all the money to the pastor. That is a disease. It is the one called OCDs, obsessive compulsive disorder. You fear that thing aches in you. You can think you can't go even to your neighbor, because to you, if you go to your neighbor, you can be bewitched. That's a irrational thinking. Don't think because you are told to go and do something by the pastor, if you won't do it, you will be harmed. No. Thank. This is Mulela. Mulela is in Theta in Juja in Kiambu in Kenya, East Africa. Please subscribe, like, and comment, and we move together. Thank you.